I was just wondering if you could put some context around the number of people that are registered. The press release today said 2.1 million British Columbians have registered on the website. Do we know out of how many? I assume it's not the full 4.3 million. And what do we make of that number so far? Is it lower than we were hoping? Is it concerning? And is it raising the potential that we get this extra flood of vaccines and we don't have enough people registered to receive them?
Thanks for the question, Rob. I think if you look at vaccination levels, over 80 and over 70 now, both close to 85%. We've obviously done a good job registering and vaccinating people in those categories. Now is the time when people in their late teens, in their 20s, in their 30s are going to get vaccinated because the vaccines are coming in the next 2 months. So people who have waited to register need to register now. 2.1 million is a good number, but we need it to be significantly higher so that in the month of June, especially when we start to get more than 300,000 doses of Pfizer a week, that we're getting to everybody. So I think it's good. So far it shows how robust the system is, that it's easy to register. And of course, a number of people haven't registered because they'd already received their vaccine. Think of all the healthcare workers and the people in long-term care had received it at the beginning. So I would say we need to do better. We need people to register, and so that we're booking clinics and filling our clinics every week. Up to now, it hasn't been an issue, Rob, because we've had a limited amount of vaccine. But in the coming weeks, we're going to need more and more people to register. Now, I believe approximately in the smallest categories, which is 18 to 24, more than 100,000, well over 100,000 people have registered. So you can see that people have been registering, but we need people in their 40s, in their 30s, in their 20s to get registered now. And people in their 50s this week, everyone in their 50s by Thursday will be able to not just register but receive their notice to book. So now is the time for everybody to get registered. 2.1 million is good, but we need to register more people so that we're filling all of our clinics in the coming 2 months so that everyone gets their chance to get the vaccine. I would say of approximately those 2.1 million, about 900,000 or so have had their appointment booked. So that means there's more than 1 million now that are looking to get their appointment booked, so they're already registered. But we want to do much better than that in all areas of the province, and particularly, obviously, in Metro Vancouver right now because of levels of transmission.
Dr. Henry, can you quantify or just maybe give us any indication what significantly earlier than Canada Day might look like in your mind for everyone getting one shot?
I'm thinking about the amount of vaccine that we are supposed to have to come in, and there's increasing amounts of Pfizer in the next little while, and dramatically increased amounts of Moderna if everything goes as planned. So this is my caveat, because we know that there's always glitches. I mean, we were quite prepared to receive Johnson & Johnson this week. We know there's been glitches with Moderna in the past. So my caveat is that we'll get there by July 1st, and I think we're going to have a really great Canada Day this year, but not a big party, just little parties. But I think by the middle of June we should be well on our way. This is going to be a key month. We're in a whole different world now, and we're going to be providing vaccine rapidly to lots more people. Our clinics are ready and able to scale up, and this is where our IT system, our registration system, allows us to make sure we get the right amount of vaccine to each clinic around the province. And you may wonder why we're saying register so much. It just helps us make sure we get enough vaccine to each of the clinics, and we will help people register. And so there's many different ways that we can get people into the clinics as well. But right now, the most efficient way for all of us is to register, to get booked, and then we know exactly how much vaccine we need to send where and how many people we need to have immunizing in different clinics.
Just regarding that last question from Rob, they're talking about the concern that vaccines could potentially outpace registered recipients with all the doses arriving this month. Minister Dix, you said we need that to be significantly higher in regards to the 2.1 million already registered. What if that doesn't increase significantly? Then what's the plan to get everyone vaccinated if they're not going to the website?
That's where we do some of the outreach that we've been doing in different areas, whether it's through workplaces, through community groups, through religious groups, so faith-based groups. The outreach that the Premier started today with a number of community leaders. So we do have many ways of getting people into our immunization programs, and we will be reaching out again in different ways to try and get people in for their immunization as the vaccines become available and the clinic space becomes available as well. And right now we're focusing on ramping up the first responders, school staff, and childcare staff. As more vaccines become available, that percentage that we've devoted to the first responder and worker groups will be increasing as well, and we're going to be able to move that group ahead really quickly in the next few weeks.
I think it's important to note that I think about 15% of the Pfizer and Moderna vaccine coming in this week, or about 50,000 doses a week, will be going to exactly to groups of frontline workers you see in certain communities, such as Surrey grocery workers, but right now, and in priority, education workers, childcare workers, first responders, and so on. So there's other ways to get vaccine out, but we obviously want more people to register, and more people are registering. We've seen that in the last week, significant increases, but we want it to do more. We don't expect that to be an issue, but we also want to get vaccine into people's arms as expeditiously as possible. So if you're eligible to be, everyone needs to register now, and as soon as they're eligible, we'll contact you, and it's important to book your appointment. And I think as we see increasing numbers of people do that, we'll be fine, but we really need it done. It's not an optional question, and that's why we're doing so much outreach on that question. But there are other streams to distribute vaccine, and we're doing that as well.